Our first speaker is Dr. Tyler Stevenson, and he's going to be talking about keeping your competitive horse competitive.
Thanks for that, Troy, and thank you everyone for showing up today. I think today is really about giving back to you guys, the clients, and thanking you guys. You guys, the horses, that's a big rewarding part of our job, but getting to know you guys and work with you guys and the wonderful clients, that's very rewarding for us as well. So thanks for showing up today. I tried to condense an 8-hour talk into 15 minutes, so we'll see how it goes. I think if you guys, if you understand the topics, maybe even not understand them, but if you just hear them, recognize some of these things we're talking about, then if your horse comes back in, hopefully you've heard of it before and it's a little more familiar to you. Okay, so really our main goal in treating horses is you need to start with a specific diagnosis. Really, if you don't have that specific diagnosis, we're kind of shooting in the dark. Because if you get a lot more specific diagnosis, it allows our treatments to be a lot more targeted. And then the end result, of course, is hopefully better outcomes. But it all starts with a specific diagnosis. So a few things we're going to talk about, a few body systems: cardiorespiratory, muscle, soft tissue, tendon and ligament, bone, orthopedic. Of course, there's a lot more things we could talk about, but I think these are the main areas we're looking at when we see horses come in with performance issues. And then we'll touch on how we diagnose some of these injuries and touch on some of the treatments as well. So if we back up and think about things that predispose horses to injuries, once again, going back to our thought about trying to prevent these things, we'd much rather try to prevent these injuries. We'd rather not see you guys come in with your lame horses and performance issues as much as we do like seeing you. But things we can think about risk factors involved with these injuries. So overtraining. So working a horse too long, repetitive movements over and over. We know that's going to put repeated stress on certain joints, certain soft tissue structures. Changing the intensity of training too quickly. So you have a horse that's been standing around for 30 days, and then you go out and you try to ride him for 5 hours. Of course, that may predispose him to injuries. Conformation, we have some studies that show that there are some conformational flaws that can predispose horses to specific injuries. The discipline or what kind of work they're competing in. And then, of course, prior injury. Horses that have had a prior injury, whether it's orthopedic, joint, or soft tissue, that may predispose them to further injuries in the future. So training factors, once again, kind of thinking about these things that might predispose horses to injuries. And this is where we might have a head start on the horse as far as we know that certain disciplines, footing, for example, if there's equipment issues, those might predispose horses to injuries. So things such as footing. We know that hard ground, if you look at both ends of the spectrum, say really hard ground and really deep soft ground, deep ground is going to have lower peak forces on the soft tissue structures in the orthopedic system, but we see those stresses sustained over a longer time. Thereby, that can predispose horses to soft tissue injuries. A very general rule of thumb, maybe deep ground might predispose a horse to a tendon or ligament injury. And then the other end of the spectrum, really hard ground, we know that we're going to see higher peak forces going up that limb, therefore maybe predisposing a horse to an orthopedic injury. Equipment, sport boots, they're good. They protect your horse. Put them on. And then, like we talked about, the discipline, just knowing what sport that horse might be competing in. We see sport-specific injuries. For example, a race horse, we're going to see specific injuries compared to an endurance horse, a different set of injuries there, and so on. So knowing these risk factors and some of the training factors, we kind of have a head start on the horse, knowing what that horse might be set up to injure. So we'll start with cardiorespiratory fitness. So the purpose of the cardiorespiratory system, of course, is to get oxygen, nutrients to tissues, and then remove waste from those tissues. Some disorders you might see, cardiac murmurs, arrhythmias, and then related to the respiratory system, equine asthma, exercise-induced pulmonary hemorrhage, or what we more commonly call bleeders. And then some of the diagnostics we perform to further investigate these areas. So if your horse is diagnosed with a murmur or an arrhythmia, EKG, echocardiogram, or an ultrasound of the heart might be places to start there. And then as far as a horse that presents with a respiratory issue, thoracic ultrasound, transtracheal wash, BAL, those diagnostics are going to give us a better idea of what exactly is going on in the lungs and the lower airways. In regards to muscle fitness, so the purpose of muscle, mobility, stability, posture. Horses, they're similar to humans. They're a little better at doing this, but they're similar to humans in that we can have differentiation of different muscle types. For example, a racehorse, a sprinter, they're going to develop muscle types, what we call fast twitch muscle types, and that horse is programmed to utilize oxygen for a short distance compared to, say, an endurance horse, an Arabian horse going 100 miles in a day. Those horses are going to develop different muscle types that are better able to utilize energy when oxygen isn't present or over a long period of time. And horses are really good at differentiating these two different muscle types, but of course they differentiate those types based on how you train them. Some disorders we see, myositis, which would just be pain or muscle inflammation, exertional rhabdomyolysis, or what we more commonly call tying up, and then some genetic disorders, which we've improved our knowledge base on these the last few years, PSSM, and a newer one, immune-mediated myositis. And we're lucky that we, in regards to these genetic disorders, we can test these with just a hair sample. So once again, going back to prevention, we can perform genetic testing on these horses as young foals. And before that horse ever goes into training, we already know if they're predisposed to some of these genetic disorders. Tendon and ligament injuries, so this, we could talk about this all day long. This is of course one of the more common causes for a horse to come in, not only for poor performance, but really lameness issues. So if we break down these soft tissue injuries into two big categories, acute and chronic, acute being something that's happened relatively recently, we can see strains, tears, complete rupture of some soft tissue structures. And then the more chronic disease processes, and sometimes that kind of blends with acute injuries. We can see horses have multiple recurrent acute bouts of soft tissue injuries, sometimes term that acute on chronic. And how we characterize that further would be maybe mineralization or calcification within those soft tissue structures, fibrosis, which is just a fancy word for scar tissue in those soft tissue structures. And we know that these horses that have had prior injury, like we said, they're predisposed to having injuries in the future. It doesn't mean for sure they're going to have the same injury, but we know when we start to see things like mineralization or fibrosis within these soft tissue structures, it changes the biomechanical properties, and you never really restore that soft tissue structure to what it originally was. But of course, some of the treatments we have, we get pretty good we get pretty close at restoring it. And same as soft tissue structures, that's probably one of the more common. You might argue it's the most common reason horses come in for performance issues and really lameness issues. And I'm sure just about everyone seen in this room has had a horse with some degree of arthritis. Maybe everyone in the room right now has a horse with arthritis. You know, if they're lucky to live long enough, that's going to be something we're probably going to have to treat at some point. As far as diagnosing these injuries, radiographs, MRI, CT, of course radiographs, easy to perform, inexpensive, not invasive, and then moving up from there, and I won't go into too much detail. We're going to talk about some of these modalities a little later, but nuclear scintigraphy, MRI, and CT examination, MRI, for example, and nuclear scintigraphy, both of those things, they number one, allow us to see the morphology or the morphologic changes within these structures, and then it kind of tells us about some of the physiological processes going on in the bone or the joint, as far as if there's active inflammation, acute inflammation, and it gives us a little more information. So right here, we just have some pictures of these different modalities. On the left there, that's an ultrasound examination right there. We see, in this image right here, we have a cross-sectional view of the flexor tendons in the back of the leg. At the top of that image, I think you can see that dark area in that tendon. So that'd be a horse with an acute tear, acute strain. The middle image, that's a radiograph, as I said, inexpensive, easy to perform, not invasive, gives us a pretty good overall idea of the bones and the overall joint health. But if you look at the MRI image on the right, that's where we really start to diagnose things such as cartilage injuries, focal cartilage defects. Those are things we can miss on radiographs. There's times radiographs don't always give us a perfect answer. And there's times that's frustrating for you guys as clients. There's times that's frustrating for us as veterinarians. But there are times where we just need more information, and that's why we're so lucky we have the ability to perform these MRIs in horses now, because going back to the first slide, if it all starts with getting a specific diagnosis. Really, without that, you're kind of shooting in the dark. Right here, we have an image of nuclear scintigraphy or a bone scan being performed on the left side. We're going to go into a little more detail with these modalities, like I said, a little later, so I'll be brief. And then the right side CT examination, and we've had our CT here for a few years now, and this has really helped us tremendously, especially with neck injuries in horses. That was an area for a long time. We could take radiographs and it'd give us somewhat of an answer, but with the use of CT now, we've really learned we were underestimating a lot of these injuries, and there were a lot of things we were missing. So we're lucky to have that diagnostic capability now. So as far as treatments, and this is just in regards to musculoskeletal treatments, we're lucky medicine has progressed over the last 40 years, and we really have a lot of options now. 40 years ago, we didn't have nearly as many options, especially when we talk about joint injections or intralesional injections. Is really just corticosteroids. And we still use corticosteroids, and that's still a treatment. But with that said, we also have some of the newer treatments that have come along, are biologic therapies. And what biologic therapies are, essentially we're just harnessing the naturally produced healing mediators, anti-inflammatory properties that the horse is already making. We concentrate that, and then we treat that in a specific location, wherever the injury is or wherever the inflammation is. And really, over the next, we'll find out 5, 10, 20 years, I think this is going to be the secret to not only treating these horses with issues, but also preventative medicine. So stay tuned over the next 20 years. We'll keep you posted. Next slide, that's fine. And then rehabilitation. Of course, this is a very important part of treating these horses and getting them back to work. And what we'll say is, we've become a lot more specific now as far as certain exercises horses can do, as far as what's going to aid a certain injury, whether it's a soft tissue injury, tendon, ligament, bone. And as a general rule of thumb, we usually start these horses low and slow. It might be us just telling you to hand walk your horse for 5 minutes a day for 30 days. And that might drive you nuts, but there's a reason we're telling you to do it, and after some period of time, of course, with subsequent recheck examinations, maybe repeat imaging, we'll get to the point where we increase that frequency of work and also the time they're being worked. So the big question of our 8-hour talk, we condensed down to 15 minutes. I think if I had to narrow it down to a few bullet points, rest and recovery. Horses, they're like human athletes, and we ask a lot of them. The disciplines that they perform, they're very demanding, but they need time to rest, and those tissues need time to recover. Especially some of these injuries, we're starting to learn more about whether it's a soft tissue injury or even bone orthopedic. We've learned that these injuries, they could start bone, for example, as small microfractures, small fissures in the bone. We're starting to see these morphologic changes in soft tissue structures, and really what we need to do with these horses is give them time to recover, give those tissues time to heal. But with that said, training is protective. Getting your horse out and working them, we know that that's going to increase bone density, increase bone strength, increase the tensile strength of soft tissue structures. So by all means, getting your horse out and working them is still protective. And then early diagnosis and intervention. We do a lot better as veterinarians treating these injuries in the acute phase rather than when it's farther along or more progressed. It's more challenging for us, and our success rates probably aren't as high. So really, early diagnosis makes a big difference. And then prevention, like we said, if we could take a step back from this and think about how do we see you guys less frequently and how do we prevent these injuries, that's our ultimate goal. So,
thank you very much, Dr. Stevenson. I appreciate it.
Let's say you're purchasing, a young horse, they've gone through the pre-purchase exam, sound, no reason for radiographs. Do you find that useful if you take a baseline and then let's say years later a problem comes up? Do you find it useful to have the baseline radiograph? Great
question, and that's a question we're asked fairly frequently. But yes, it does help to have that baseline radiograph. First of all, when you're purchasing the horse, of course, you're you're making a sound investment, or at least you're hedging your bets on there's no prior injuries, no morphological changes at that time you purchase the horse. But then if we follow them out, say 3 or 5 years, and we follow up with those radiographs, it lets us see if anything's changing. And most of the time it's probably joint disease is what we're looking at, but we could see if anything's changed in the last 3 to 5 years. Hopefully it hasn't, but if it has, it tells us we need to address it and treat it. That's a good question.
If you're purchasing a horse, and California is not always the best place to get a good deal or get a good quality horse, and you do it on the East Coast, if you're buying something of a distance that far and you can't visit it local, and they provide you a vet certificate, are there certain areas you should look for them to show you portions of the horse? Like, the one thing I found, it would have been nice to have them take pictures of the feet, the bottom of the feet and everything else, so could see if it had any thrush or anything like that. But I'm curious, when you're going into something like that, what recommendations do you have to mitigate the, your chances of getting something you don't want?
Yeah, and that's a good question, and we're faced with that frequently as well. And a lot of it, you're kind of putting your trust in the veterinarian on the East Coast, right? Because we can't be there. So that's the first thing. We're putting a lot of trust in that veterinarian. But then, of course, there's certain areas, and it might even depend on the discipline or what you're using the horse for, whether there's certain areas that we want to pay more attention to, whether it's specific radiographic views. Of course, the examination from that veterinarian, hopefully they're going to tell us if there's any red flags or any problem areas that we need to look into as well. Does that answer your question? It's hard for me to come up with a specific list and say this is what you need to look for. I mean, every pre-purchase exam, of course, we're going to be thorough and comprehensive about it. But I will say sometimes that does vary depending on the age of the horse, what the horse is being used for.
I'll just add, we do collaborate a lot on pre-purchases, especially stuff coming in from overseas and stuff. So that's something that, even though we're not maybe wherever the horse is at, we can help you with that. And then, like you mentioned, and be really good to get nice confirmation pictures if it's prior to the pre-purchase exam, making sure that the hoof angles look good. There's no other conformational flaw that we can see just on a visual picture. And then whether you pursue a pre-purchase with another veterinarian in that location, we can collaborate. That's something we do commonly. So,
in regards to arthritis, and an older horse is just kind of sort of borderline getting sound, is it just oral supplementation for feed to help them with that, or are there treatments?
Yeah. We have more options, we're lucky, but as you mentioned, oral supplements or nutraceuticals, that's a place to start. That's even a place to start long before they ever develop arthritis, right? Going back to prevention. And then from there, our other systemic treatments, if you will, would be Adequan, Legend. Adequan, that's going to provide the building blocks to help support cartilage. Legend, hyaluronic acid, that's going to support healthy synovial fluid. And then our more targeted treatments, whether it's intra-articular joint injections, which we briefly touched on, corticosteroids, hyaluronic acid, all of our biologic therapies we have, IRAP, PRP. We have a lot of options stepping up from there.
Tyler, when you talk about performance horses and rest and recovery, what does that time frame look like for you? Because our horses they're high performance horses working pretty hard 6 days a week. And when we work them, we do give them periods of rest and recovery, but what does that look like in your mind?
Yeah, that's a really good question. I'll say the most science we have on that is dealing with race horses. One study in particular, they looked at 1 day off a week, and maybe it's not as much time off. Say it might not mean your horse doesn't need to be ridden, but as far as the training intervals, only having 1 day a week where it's a hard work, and then the other days getting them out and exercising them and keeping them fit. But it's hard to... we don't have a lot of studies on other disciplines, so that's something we just have to tailor that program to each individual horse.
okay, thank you very much, Tyler.